All right. Well, this is another conversation on Stoop Talk. So, if everybody wants to know what a Stoop Talk is if you ever grew up in the Northeast, specifically New York, every conversation that you can possibly have, you had on a stoop with your friends, with your family. And so that's the type of conversation that we are going to have with my friends and my family about money. And so today I'm going to talk about one topic in particular that's going to impact several people, and that's debt, especially debt that is coming from healthcare costs. And to talk about that, I have my brother, Shawn Blount, who's going to talk about medical debt from his perspective of someone that's been in the debt collection business for several decades now. He's going to be able to speak to that. And then I can just speak more broadly about what I think is a general problem around debt, and kind of between the two of us, we're going to help people figure out how they can avoid some of these things. So, Shawn, why don't you go and introduce yourself so everybody has a good idea of who you are and what you do?
How you doing? I am Shawn Blount. As he said, I've been doing medical billing and collections for the past 20 years. So I've seen a lot of claims pass by and see how claims process. And I've talked to a lot of people and helped them understand how they came to their personal responsibility with the debt. So that's kind of what I've been doing for the past 20 years.
All right. Well, thank you. I think that helps. And so, one of the things that it is going to be helpful as we go through this conversation is that it's really just regular experience and dealing with regular people that we're going to talk about. So, there's no need to be complicated with it, but that's the perspective that you're going to bring in. I want to give a
Sure.
little overview of kind of why this topic is important. First and foremost, sometimes to build wealth, you just have to avoid being broke. And so, one of the things that's incredibly important is to make sure that you have a way of avoiding emergencies, avoiding costly items that are outside of your control, especially things that you could have planned for previously. And one of the things that impacts a lot of people, whether it is younger people that are going through it or older people that are going through it, it's medical debt, specifically debt that came from being sick, injured, unable to work, or simply just not understanding insurance policies, how they work. And so we're going to try to tackle some of those. I've just been able to describe that a lot of people have the debt. Some of this debt is avoidable. And if we can teach people to not be broke, we can teach people how to build wealth. So, what are some of the things that you see as the mistakes that people are making, or why you end up calling them in the first place? What are some of the more common reasons that they end up on Shawn Blount's call list or activity list for the day?
I would say understanding how your insurance works and how things come out for you to have a patient responsibility works. So I think when you're picking your insurance plan, you should really look at that like in great detail. It shouldn't just be like, what's the cheapest amount that can come out of my check? I think you should definitely look at it. Most of these plans, I think they come with like a good, better, or best kind of tier. And I think you should look at each tier and see how it works for your family and your need, because that deductible when out of pocket definitely plays a part into how much you're going to pay and what you're going to owe. So I would say, first off, just understand the policy and what you have, because in essence, you come to like this agreement with this insurance company, like, okay, I'm hiring you, me and you are going to pay these medical bills together. You want to know how much of a percentage they're going to pay and how much you're responsible for and when do they kick in. So it just leads to less surprise. So understand that I think it's a really good thing.
And I would say with that understanding, it's understanding what you actually are using insurance for, which is for the surprises that you brought up, right? So
Yeah.
you talked about people choosing their plans based on what they can afford, but let's talk about how you should choose
What they
your
need.
plan. Yeah, what they
Yeah, you
need.
got to pick it on what you need, I would say. Let's say you're a single person and you don't really go to the doctor much. So you want to, the deductible is the main thing. Let's start here. There are four ways that patients are responsible. There's a copay. That's when you go in the doctor and they ask you for your little fee and walk in the door. There's co-insurance. Co-insurance is your portion that you pay with the insurance. Y'all are in agreement. Most of these agreements are like an 80-20 split. They're going to pay 80%, you're going to pay 20. That's your co-insurance. Another category for you to be responsible for. Then you have your deductible. This works like your car deductible. I'm not going to pay anything until you pay this part, and then I'll pick up the rest. And then you have this out-of-pocket max, which is just another fancy word for deductible. It's just another category that you have to hit before they kick into 100%. So I think that people, if you pay attention to those things, a single person could, let's take this example. When you go to work and you pick the plan and they say they have a $30 plan that comes out of your check every month, and they have a $50 plan, and they have a $60 plan. That $30 plan may not be the best plan just because it's less out of your check, because you still have to hit this deductible and you're not paying as much into it. So that means every time you go to the doctor, you're paying more for these services. But let's say you pick the middle or the high grade, a little more came out of your check and your deductible is lower and you hit that number faster. So then now we can not be paying so much. So I think if people understood like what they personally need, a single person, they could pick a low deductible plan, be okay, not be so much. A person with a family, they got more to factor in. Maybe my kid has an illness, or I have an illness, or my wife. You got more things to take into account. But you definitely want to understand how much am I supposed to pull out of my personal pocket for the calendar year for my insurance. And that is what a deductible and those things are. So looking at those things are going to matter.
Yeah, and I would describe it as well. Like, you got to think of your deductible as the amount of money that you can come up with in an emergency. So
Whew,
think of it
that's a good way to
as
put it.
if an emergency came up and you had to sit there and call all your friends and family and say, hey, I need this money real bad because I need to have surgery or something like that. Like, how much do you think you're going to be able to pull together?
Yeah.
Because that's what a deductible actually is. And so if you
Yes.
think that in that situation you could only pull together $250, then $250 is going to be your deductible, right? Because that's what you can get from your friends and family if you needed it. And so you need to pay the insurance to be able to cover you to just handle that deductible, as opposed to, for example, a $500 deductible, which, if you don't believe in these situations that you could get $500 for your friend and family, then without paying that deductible, you basically lose the value of insurance. So speak to that, right? If you don't at least pay the deductible in your world, you're basically self-insuring, right? Which means you're paying all these bills yourself. So talk about that, how if you don't hit this
Yeah. Yeah.
deductible, that you're not really using the insurance, you're basically just paying for it all yourself.
Man. Yeah. Let's take a small number. Let's say you have a $500 deductible and a $500 out of pocket, but you don't go to the insurance that often. So anytime you would go, they would apply something to that number. So the insurance would never pick up and pay at 100% because what they would have paid, everything gets applied to your deductible. So if you never really use this insurance and never really go, you're pretty much self-pay, not self-pay. You're pretty much not using their insurance. Your insurance is supposed to be there for when you have an emergency, and nobody really wants to use their insurance or run up medical bills. But if you pick a high deductible plan, when you had an option to pick a low one, it does put you in a position to where you never really use the benefit of them paying dollars for you. The benefit you would get is that they have a contract with these hospitals, and you can take advantage of discount plans. So when insurance bills an insurance company bills a insurance company bills I'm sorry, when a facility bills an insurance company, what they allow and what they pay, or what they bill and what they pay are not the same thing, and they know that. So you want to get to where they pay money for you and not just give you discounts. Because if you never hit your deductible, they never actually sent money. You just took advantage of them writing things off and doing justifiable adjustments on your behalf because you're a part of their insurance group. But we want them to spend money on our thing and make it
Yeah,
helpful for
one
us. But
yeah, one part is like they help you with paperwork, right? And then the other part is that they give you that paper in money forms, right? So one part, they help you with the paperwork to get everything through and telling you what your bill is going to be, and the other
mm,
part is helping you with this paperwork and then paying that bill. But that's what deductibles do, is
they're not
that
really paying
no,
money.
it really is a place that allows you to figure out where your responsibility ends and the insurance companies picks up, so
And
to
what the
speak, right?
problem that most people have with insurance is people have such high deductibles now. you may have a $5,000 deductible and a $5,000 out of pocket. And what happens is it becomes hard to hit that number in the calendar year because it all starts back over in December and it's a regular calendar year. So hopefully you don't have anything major if you don't want to, that you had to spend $10,000 on your medical bills for the year. But even if you did happen to hit your deductible and your out of pocket, January 1, it started back over again. So it becomes to where you never really get to use the benefit of it because it's hard to hit those big numbers in a 12-month time. And they know that. So it's how insurance is. I think they have it structured that way, but it is kind of hard to hit. Like my personal one is $3,000 deductible, $8,000 out of pocket. I don't go that much, thank God, but at that point, I wouldn't have been to the doctor that much for them to even come close to kicking in and paying at 100%. So the times that I would go on my regular routine visits and things of that nature, I would get the advantage of only paying, let's say, 20% of the cost of these things. So they didn't actually spend money on my behalf. I just took advantage of them being in network and having a contract with these places, and they get to knock some off and I pay less than what it actually did cost. So there is some benefit though, but people always say, well, I think I paid enough into insurance. It doesn't work like that. It's about how much money has been applied to these categories. Until you hit these categories, they're not necessarily going to cut checks.
Yeah, maybe let me take a time and explain insurance and then maybe talk about the mindset behind it. So let me start with the mindset part. So if we're starting to make our decisions based on what's cheap, right, that's going to be one problem because that's not the purpose of insurance, to be as cheap as possible for you, right? The purpose of insurance is to try to help out, cover some of these costs, cover some of these medical expenses as they come about. And so if you're looking at this paperwork and you're looking at it in terms of your cheapest option, that's what we end up having when you have these high deductibles that you're never hitting a year, or that you don't need. Like, that's actually just meaning you don't need the insurance because it just needs to be more of a reasonable number. And that's because people need to understand what insurance actually is. So there's two types of risk. There's the first type, which we call speculative risk. That just means in any given situation, you can either win or lose. That's like gambling, virtually anything. It's a flip of a coin. Jobs, everything, we take speculative risk. We have there's a possibility that it will turn out good, possibility that it turn out bad, but they're both possibilities. And so that's what makes it good. You don't have to insure that stuff because you just have to deal with fate, prepare yourself. Other type of risk is called pure risk, which means if something happens, like, you're done, right? So you die, you die. There's nothing else coming back. If your car is totaled, it's totaled. You can't get your car back. If your house burns down, it's done. You can't get your house back. And so things that are more permanent in nature or would be more catastrophic in nature, you got to insure that stuff, right?
Yeah, for sure.
You insure it because if these things happen, it will be a loss, a guaranteed loss, as opposed to a speculative loss. So what do we insure? We insure our house. We insure our cars. And so if most people treated their bodies like they treat their cars, they would actually understand how much they pay a month. They would understand kind of what they want to pay in deductibles or split limits. Like, it would all tend to make sense. And so that's really how we need to think about health insurance or other types of insurance. The reason why most people have debt is because they don't treat it like their car insurance, or they don't take it seriously, or they don't think they'll ever go to the hospital, or they don't think they'll ever need it. And then they do, and then they're in the hospital for days, or they, you have to take an ambulance, and that's $1,500, and you didn't even realize that was there.
And it costs more to turn the lights on. That made it more of an emergency, so that's an extra cost. Like, it costs a lot like to get hurt or be sick.
Yeah. Also, it's also one of those things where people have to just be aware of, their own life and quality of care. Don't put people in decisions where you got to doubt whether or not you want to be healthy or not. You know what I mean? Like, doctors, nurses, they're going to try to save you. You can't be in situations where you're like, no, I don't want you to save me because I can't afford to be safe right now. You know what I mean? Like, as crazy
I've
as
been
that
in this
sounds,
situation.
you can't have those types of thoughts in your mind. And so a lot of this is just peace of mind, right? So that way, in these situations, you don't got to sit back and be like, no, please don't give me that life-saving surgery because I can't afford it. You want to be like, no, save my life, right? That's the real
Yeah,
That's what we're really talking about when it comes to coverage, deductibles, understanding, being aware, is that it just avoids an outcome that you don't want, which is that you are going to get sick, and it's sometimes of your control. Accidents happen, that's outside of your control. And when they do, you don't want accidents or things that are outside your control to anchor you down for the rest of your life. Like, I think that's what it comes down to.
it definitely
What are some
does.
of
It
the
definitely does.
resources that people can have? Because that becomes another thing. If you can't afford it, or you get into these situations, obviously, we can't tell everybody beforehand because some people are already in this situation. So if people have
Yeah, yeah.
already accumulated some debt, or they're trying to figure out ways to get out of it, what are some of the things that you think you could do for them, or that is available for them as resources?
Oh yeah, I mean, you gotta definitely do your your research on your particular thing. So if you have like they have grant programs and those open and close quickly and things like that. But those are more specific to diagnosis and things like that. But those are always available to you. Um, you have copay assistance programs if you're on a certain particular kind of drug, that those are really great. Those programs don't even have like an income limit. I've seen people who can make up to $100,000 a year and still be on some of these programs that will help them with the cost of particular drugs.
Mhm.
um, the the hospitals, they definitely have like these social workers that come and talk to you. Utilize that thing. They have all kinds of things and programs and things that you did not know about that can help you with your debt before it even goes bad, you know. They have charity programs that you can apply for. Sometimes you don't have insurance at all, and they have self-pay discounts that are comparable to the discounts that insurance gets. Like, it doesn't have to go as bad. I understand that you got hurt or had a sickness you didn't ask for, or got damaged and you have a bill, but if you just knew what you could do, you could lessen how much you have to pay. You're not going to go to zero. You're not going to be able to find enough things to where you didn't pay anything, but you can find a couple of things that bring your cost, your out-of-pocket responsibility down to something kind of reasonable. But yes, it definitely takes some research, but these definitely programs and things that are out there for people before it actually gets to collections and going bad. And now it's in a debt agency where they're talking to you harshly. It's just, something can be done before it gets to that point.
So it seems like, I think what I'm hearing then is that from a pre standpoint, you can stop a lot of this with deductibles, being more aware of the insurance plans, picking that out appropriately, and having this opportunity to actually, prepay through some of this, so that way, if an emergency does happen, your insurance actually kicks in.
Yeah, yeah, yeah.
Right.
Like some people
If
have
that,
these flex pay cards with their job. That's a way too. So you know you have a $5,000 deductible, and now you get to. Most companies offer you these things. They give you a way to have tax-free money allocated over here. That's on this card that you can use for your doctor visits and copays. And that's a definite way of being responsible about the debt you know you're going to incur because you pick this type of insurance with this type of deductible. You have a handle on it before it gets way crazy, and those are good things too.
Mhm,
So yeah, you have the money already sitting there. Now you can use these cards. So
mhm.
yeah,
And
understanding
then
what you
after the
have.
fact, you have these grants, charities, the research, everything else that allows you to then go in there and say, okay, like, I've accumulated this stuff, but now I can actually take care of it. Right.
I can take care of it. Or I can get some assistance with it. Somebody can help me with a portion of it. Let's say that after the responsibility, you went got this thing done, and your out of pocket responsibility is $1,000 of the thing. Now, yes, you're gonna every dollar that you spend towards this is gonna go towards your deductible magic number for the year. Sometimes you just need help getting that money because the insurance company just applies the money there. They don't call a doctor's office to find out did you actually pay the debt. They just want to know, have they applied enough money to your responsibility so they don't have to pay. So you're
Mhm.
trying to the patient is trying to figure out how do they get the funds in these places. And you can be creative with these processes to find out, okay, I can get a little bit here. Think about going to college where you ask, like, I'll do some essays and get a grant here to help me with a couple books, and that little $100 whatever, $1,000 whatever, help with your books or your whatever. You pieced it together to get to where you had to go. It's kind of like that type of thing for medical resources,
Mhm.
or to
And
help
I
with the
was
cost, I should say.
Yeah, I mean, I have this conversation with the students that I teach at college. I think, a lot of them don't think that they are going to be unhealthy, but they're
Yeah.
athletes. They are on campus with COVID. And so, it happens all the time, concussions, or, they are breaking something. And so there's this need to have it when they're at school because they know if they're athletes or they're doing something, these types of things will
Chances are pretty
happen.
high.
But then when they get out of college, they don't do that. And so it's really transitioning from the times that you know this is done for you. So most people can be covered under their insurance up to age 25. So people go well through high school into college while they're still on this, on their parents' plan or some other plan. So they don't know all these details. And then by the time they're 25 and doing it on their own, some of this stuff can be a little bit overwhelming. So this conversation is helpful for those people that are coming out of that transition of you're coming off of this mandatory period of up to 25 where like you have to be covered by some health insurance under the Affordable Care Act. And so now you're coming off of that. Then these are the decisions that you have to make. And so we're talking about deductibles, making sure that you use insurance correctly, or if you haven't used it correctly, how you can rebound through grants, charities, other types of programs to be able to level set. Does that sound about right for
This sounds
these
about
people
right.
as we're
Definitely
going
sounds
into?
about right. Absolutely, absolutely. Pay attention to what you're getting. Pay attention to your need. This is nothing you can throw on autopilot. You really have to look
Mhm.
at your specific need and kind of like take it very serious about what you're going to need and what you forecast because you're going to be responsible for a portion of it. It's insurance. So like this co is help. There's no magic thing that you can just do this and it goes away. So you have a part in it too. So I think people should definitely look into it and take it serious. And they do. I think I remember when I was younger, it was just like I go to the doctor, I pay my little copay at the front desk, and I never really got a bill. It was on autopilot. You know what I mean? Until I got older and started having to go to a doctor for more things. And when you're younger, you're not going when you're supposed to. But then you start getting older and you need it more. You're going for more routine things. You have children, they have problems. You start to use it more. So I think once you start to use it more, it behooves you not to understand it. You
Mhm.
have to. The percentages, the splits. You can when you're young, I think you can kind of like, I'm on my mom's insurance. So, I don't know, kind of thing. But once it's yours, take ownership of it and know what it is. Just like your home insurance, it covers my roof, my appliances, that every detail about that one. Know as many
Yeah.
details as you can know about this one as well, because it's just as important. Like you say, how people think about their cars and their homes, insuring your body, you should be that meticulous about this thing too.
Mhm. Well, I think that's the type of advice we leave them with because basically you get up until age 25 to have somebody do this for you. But then after that,
Yeah,
it becomes your responsibility for the rest of your life. And so, be aware of what's happening. And then when it's your turn, when it's your opportunity to actually do this for yourself, take advantage of the insurance and make sure you understand kind of what it means to take on, certain types of plans, certain deductibles, copays, or whatever the case may be.
yes.
All right. Well, I appreciate it, man. I think, for Money Talks, this has been helpful. It gives everybody a good understanding of medical debt, where it comes from. It also gives you a good perspective on kind of when to do this. 25 is a good age, gives you an idea of what deductibles are, what some of the different types of questions that you have to answer, like is it co-insurance, what's your copay or your deductible, what's your annual limit, whatever the case may be. Those are the questions that I think people need to be aware of. But then also,
Definitely.
if they get into a situation that there's resources on the back end, and you mentioned a couple of them, but there are some charities. You can work with the hospitals. You can apply for some grants, and sometimes they don't have these income limitations, and you can actually use them pretty good.
Yeah, don't have. I've seen people have shame about it. Like, well, I work and I don't want to apply for it. It's not a shame thing. Not all of these write-offs are based on you being indigent. You know what I mean? It's just debt to income ratio type of thing. So it's a real thing. So yes, for sure.
Yeah, and I mean that's a whole another issue, right? Like feeling shame about something, like we could deal with that. But like when we talk about debt and making sure that you have the resources, that's just your financial health, right? So at
Yeah,
some point you got to just be okay, and kind of without that you will continue to not be okay, and that's kind of good advice or good way to kind of get it. So I appreciate it, man. I think that's a simple way to do it. That's how we would have done it on the stoop when we were kids. So I think that people can appreciate it. So thank you kindly for your expertise. I hope everybody gets a good opportunity to take advantage of some of this information with their plans. And then I'll see you soon for another talk on another topic, but probably another family member at some point soon.
I enjoyed it. Thank you.